Starting in my early 20s, I began having some extreme changes in my mood and behavior. I was making all kinds of impulsive decisions. One day I would go on a huge shopping spree, not worrying about the money I didn't have. The next day I felt so depressed that I would end up in bed all day not doing anything. And this back and forth would happen day after day after day. There was no happy medium. Living with these symptoms was driving me crazy and I didn't know what to do. The hardest part was never knowing what my day was going to look like. As a mother, it was becoming tougher to take care of my kids. I was always worried today would be the day they couldn't count on me to be there for them. I knew I couldn't do this alone and finally reached out for help. I began to see a doctor for the symptoms I was experiencing. I never received a diagnosis, but instead was treated for the symptoms and not the condition. The antidepressants that I was taking helped a little, but nothing was working for me the way I needed it to. A few years later, I found a new doctor that saw me, talked with me, and diagnosed me right away with bipolar I depression. When I was finally diagnosed with bipolar I depression, I was initially worried that this meant I was crazy. I worried about the stigma associated with bipolar depression and didn't want to accept it. But with bipolar I depression, I know it's hard to keep your emotions in check. I took a moment and asked my doctor what this means. It was then that I became relieved because my doctor told me that together we could manage this. After a few years of treatments that were successful at times and were not at others, I finally had a doctor tell me about a medication called Caplyta, lumateperone.
Caplyta is an FDA-approved prescription medication used to treat depressive episodes associated with bipolar I or bipolar II disorder in adults. I consider Caplyta as a treatment option because I like that it is approved to treat both bipolar I and bipolar II depression. I also like that it is one pill, once a day, and no titration is required to reach the effective dose. For patients experiencing bipolar I or II depression, I often prescribe Caplyta. I feel that the proven efficacy and well-established safety and tolerability profile, along with the convenient dosing, make Caplyta an excellent choice for a patient like Lindsay. But remember that while every patient experience will be unique, it is important to monitor for potential side effects such as sudden mood changes, behaviors, or suicidal thoughts.
When I talked to my doctor about Caplyta, I liked hearing that Caplyta could make a real difference when it comes to improving my bipolar depression symptoms. Getting these symptoms under control was important to me. Weight-related side effects are always something I consider when taking a new medication. So I was glad to learn that weight gain on Caplyta and changes in blood sugar or cholesterol in the short and long-term clinical trials was not common.
I tell all my patients how Caplyta is approved to provide significant relief from bipolar depression symptoms and that they may see improvement in the first week, with additional relief over the course of 6 weeks. Of course, everyone's experience is different, and patients should work with their healthcare provider to determine what treatment is the best choice for them. Like with any medication, there's potential for side effects with patients considering Caplyta as a treatment option for their bipolar depression. I encourage all my patients to be proactive and to come to me with any questions they may have. I'm also careful to talk through potential side effects with patients considering Caplyta as a treatment option for their bipolar depression. I make sure my patients know that it's important to call me if they experience fever, confusion, stiff or uncontrollable muscle movements, which may be life-threatening or permanent. I also make sure my patients understand that antidepressants may increase the risk of suicidal thoughts and to call me immediately if they experience any of these thoughts or have any sudden mood changes or behaviors. And remember, Caplyta isn't right for everyone. Caplyta is not approved for dementia-related psychosis as it can increase the risk of death or stroke. Please be sure to listen to the important safety information towards the end of this video.
Before I started Caplyta, I told my healthcare provider about all the medical conditions I had and medications I was taking. My doctor and I went over the potential benefits and risks of treatment, including the most common side effects such as sleepiness, dizziness, nausea, and dry mouth. Because my symptoms of bipolar depression are under control, I'm getting out doing things that I want to do. This was just my experience and results may vary, so it's important to work with your healthcare provider to monitor any side effects you may experience.
The symptoms of bipolar 1 and 2 depression present in various ways. It is important for me to treat every patient as a unique piece of the puzzle because it's not a one-size-fits-all condition. I asked for Lindsay to be open and proactive when it comes to managing her bipolar 1 depression, and that has helped us develop a treatment plan that works. And with Caplyta, I've been happy with the progress that Lindsay has made.
Since taking Caplyta, I've noticed a real difference. I have less extremes in my mood. And on most days, I get out of bed in the morning and I'm ready to face the day.
Important safety information. Medicines like Caplyta can raise the risk of death in elderly people who have lost touch with reality, psychosis, due to confusion and memory loss, dementia. Caplyta is not approved for treating people with dementia-related psychosis. Caplyta and antidepressant medicines may increase suicidal thoughts and actions in some children, adolescents, and young adults, especially within the first few months of treatment or when the dose is changed. Depression and other serious mental illnesses are the most important causes of suicidal thoughts and actions. Patients and their families or caregivers should watch for new or worsening depression symptoms, especially sudden changes in mood, behaviors, thoughts, or feelings. This is very important when Caplyta or an antidepressant medicine is started or when the dose is changed. Report any change in these symptoms to your healthcare provider immediately. Do not take Caplyta if you are allergic to any of its ingredients. Get emergency medical help if you are having an allergic reaction, rash, itching, hives, swelling of the tongue, lip, face, or throat. Caplyta may cause serious side effects including stroke, cerebrovascular problems in elderly people with dementia-related psychosis that can lead to death, neuroleptic malignant syndrome, NMS, high fever, confusion, changes in your breathing, heart rate, and blood pressure, stiff muscles, and increased sweating. These may be symptoms of a rare but potentially fatal condition. Contact your healthcare provider or go to the emergency room if you experience signs and symptoms of NMS. Uncontrolled body movements, tardive dyskinesia, TD, in your face, tongue, or other body parts. TD may not go away, even if you stop taking Caplyta. It may also occur after you stop taking Caplyta. Problems with your metabolism, including high blood sugar, diabetes, increased fat, cholesterol, and triglyceride levels in your blood, and weight gain. Your healthcare provider should check your blood sugar, fat levels, and weight before you start and during your treatment with Caplyta. Extremely high blood sugar levels can lead to coma or death. Call your healthcare provider if you have any of the following symptoms of high blood sugar: feeling very thirsty, hungry, sick to your stomach, needing to urinate more than usual, weak, tired, or confused, or your breath smells fruity. Low white blood cell count. Your healthcare provider may do blood tests during the first few months of treatment with Caplyta. Decreased blood pressure, orthostatic hypotension. You may feel lightheaded, dizzy, or faint when you rise too quickly from a sitting or lying position. Falls. Caplyta may make you sleepy or dizzy, may cause a decrease in your blood pressure when changing position, orthostatic hypotension, and can slow your thinking and motor skills, which may lead to falls that can cause broken bones or other injuries. Seizures, convulsions, sleepiness, drowsiness, feeling tired, difficulty thinking and doing normal activities. Until you know how Caplyta affects you, do not drive, operate heavy machinery, or do other dangerous activities. Problems controlling your body temperature so that you feel too warm. Avoid getting overheated or dehydrated while taking Caplyta. Difficulty swallowing that can cause food or liquid to get into the lungs. The most common side effects of Caplyta include sleepiness, dizziness, nausea, and dry mouth. These are not all the possible side effects of Caplyta. Tell your healthcare provider if you have or have had heart problems or a stroke, high or low blood pressure, diabetes or high blood sugar, problems with cholesterol, have or have had seizures, convulsions, kidney or liver problems, or a low white blood cell count. Caplyta may cause fertility problems in females and males. You should notify your healthcare provider if you become pregnant or intend to become pregnant while taking Caplyta. Caplyta may cause abnormal involuntary movements and/or withdrawal symptoms in newborn babies exposed to Caplyta during the 3rd trimester. Talk to your healthcare provider if you breastfeed or are planning to breastfeed, as Caplyta passes into breast milk. Tell your healthcare provider about all the medicines you're taking. Caplyta may affect the way other medicines work, and other medicines may affect how Caplyta works, causing possible serious side effects. Do not start or stop any medicines while taking Caplyta without talking to your healthcare provider. You are encouraged to report negative side effects of prescription drugs. Contact Intracellular Therapies, Inc. at 1-888-611-4824 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch. Caplyta is available in 10.5 milligram, 21 milligram, and 42 milligram capsules.